Hi, I'm Dr. Gregory DiFelice. I practice at Hospital for Special Surgery in New York City. My practice is focused on sports traumatology and joint reconstruction. I've been in practice for about 23 years, and over that time I've operated on thousands of patients. My mother said that I started saying that I was going to be a doctor from a very early age, around 8 or 9 years old. And I just always knew it. That's what I wanted to do. I was an athlete my whole life. I played every sport under the sun. I went on to Princeton University, where I played 4 years for the football team there. And it made me aware of all these sporting injuries. And my interest in athletics led me towards orthopedics and sports medicine to try and be able to intervene and help people get back to an active lifestyle. So my practice started out very broad. In the beginning, when I first went out to practice in 2000-ish, I was the chief of sports medicine and joint replacement surgery at a big city hospital up in the Bronx, trying to bring the standard of care that I was taught at Hospital for Special Surgery to an area that hadn't had that expertise previously. Eventually, I wound my way back to the Hospital for Special Surgery, where I've been for the past 10 years. My practice is based on sports traumatology. A lot of people out there say either you're sports or you're trauma, and I kind of straddle the fence in between. Sports medicine tends to deal with a lot of soft tissue injuries. Trauma tends to deal with a lot of broken bones. And I think there's a sweet spot in between where you can help patients with having expertise in both. It's this cross-pollination of ideas and techniques that allows innovation to occur. It's not really supposed to be only about athletes, right? I mean, I talk about the thing is that life is the sport. It's not just athletics. Whatever you play, or if you don't play anything, some people have injuries just stepping off the curb, or unfortunate accidents that happen in our lives. And so once you start studying in orthopedics and getting into the fix-it world, you realize just how many things there are out there to fix, and it's not just athletic injuries. That's kind of what drew me, that set the stage for me to be a doc, and what drew me into the orthopedic sports medicine world where I live now.